Hello, everyone, and welcome to the show once again. Welcome to our interview today. It's still me, Dr. Ifunanya Anyanwu, also known as Dr. STM, your host on this YouTube channel today. And ThummimNg is bringing to you a new episode today. Today, we are going to be discussing on handling medical emergencies. For what we know, emergencies are what, just like the name is, emergencies. So there is no one who go out planning their day for emergencies. It could be there in the kitchen, as you're lying down, as you're taking the children to school run and the rest. So we have to get ourselves equipped on what to do should we be faced with these kind of things. We may be the victims, the person near to us may be the victim. Whatever be the case, we need to know how to handle it. And today, we brought in someone very well versed in this knowledge of medical emergencies. As long as emergency medicine is concerned, she is a guru. That's what I call her. And she's no other person than Dr. Abiola Fasina. Today we are going to know more about her and get to know more about medical emergencies. Before I get her in, permit me to let you know more about our guest today. So this is Dr. Abiola Fasina, and she's such a pretty lady. Dr. Fasina is an emergency critical physician and a health policy consultant based in Lagos, Nigeria. She completed her training in emergency medicine at the Mount Sinai School of Medicine in New York. And after several years of practice, she then completed a 2-year fellowship in emergency point of care ultrasound. That's what we call POCUS, and a master's in health policy research at the University of Pennsylvania. Now, Dr. Fasina is actively involved in emergency medicine care development, and focus education in Nigeria. And she's also an active board member and fellow of the Faculty of Emergency Medicine at the National Postgraduate Medical College of Nigeria. Her work has focused on capacity building of emergency health systems in low and middle income African countries. She has worked in Nigeria, Liberia, Ghana, Rwanda, Kenya, Tanzania, Uganda, and Zanzibar, and has extensive international experience. So you see, we are getting to you. You're a real guru as long as medical emergencies are concerned. Dr. Fasina is the medical director and CEO of Emergency Healthcare Consultants, a healthcare consulting company focused on capacity building and training in emergency medicine and critical care. EHCON has managed several medical facilities, particularly in the era of COVID-19, including the 80 OSA COVID-19 is Isolation and Treatment Center and the Vedic COVID-19 Hospital in Lekki. EHCON also runs the West Africa Zonal Expert Academy. And Dr. Fasina is also the Chief Medical Officer and Consultant Emergency Physician at Al Jalad Hospital, Lagos, Nigeria. And she's equally an independent instructor here with us at ThummimNg. Ladies and gentlemen, welcome to the show today, Dr. Fasina, our distinguished guest. Dr. Fasina, welcome, and your guests are happy to have you here today.
Hello, how are you? Again, thanks so much. My name is Dr. Fasina and I'm happy to be here.
All right, you're welcome. You're welcome. We are so happy to have you here today. And I think we are not just happy, but more privileged to have such a well versed doctor to come talk to us on medical emergencies today. So we'll quickly get into it to know what exactly are medical emergencies.
Well, the first thing that you said that was apropos is that, of course, nobody can predict them. But medical emergencies comprise threats to your life or your health that are potentially life threatening or fatal, um, and that require some sort of medical stabilization and initial treatment. That's really what I would think of as a medical emergency. And they
Oh,
can take
that's
all colors, all kinds of things could be emergencies. As long as your life is in danger and your health, then that's what we would constitute or think of as an emergency.
that's impressive. So, with what you know so far, what are the common emergencies that we do encounter?
Well, the common ones in Nigeria really are, I suppose one of the most common ones are the road traffic accidents. And those would not surprise anybody. They're a big source of trauma in this environment. We know the quality of our roads, we know the kind of drivers on our roads, and we also have a variety of different kinds of vehicles on the road at the same time. We have the Okada drivers, we have the Mawa drivers, we have the
Yeah.
Voleyes, then we have the private cars, and then people on Legady's Benz. So everybody's going on the road at the same time, and
Yeah. Yes.
not everyone has proper driver education. I would actually say most of us in Nigeria don't. And so that's the number one cause. Another big source of medical emergencies in this environment are actually infectious diseases. So we
Okay.
have quite a number of emergencies that stem from malaria, that stem from typhoid fever, that stem from Lassa fever. Now we have emergencies that stem from COVID. They're usually complicated by the fact that a lot of us do a lot of home treatments, and so Nigerians tend to present quite late to the hospital for a variety of reasons, including suspicion of the medical system. And then, of course, there's also the folks who go and try the local remedies before they finally seek medical care. So we frequently see things that maybe in the beginning might have been treated easily, but have come in quite late and have become quite complicated.
Oh, that's impressive. So after road traffic accidents, the next ones are usually complications from things that should have been easily treated, infectious diseases.
Yes,
Now,
a lot of times.
with respect to age and gender, are there some common medical emergencies with respect to, like, we could say, amongst elders, these emergencies are more common compared to teenagers or something like that. Then genders too.
Sure. I mean, of course, in the young men, we see a lot of the road traffic accidents and trauma
Okay.
injuries. And that kind of bears out the pattern throughout the world, where young men are usually the most common victims of trauma.
Okay.
Unfortunately, we see women here too with trauma because of intimate partner violence, domestic violence. We may see some of that here as well. I'm sure we are under reporting the numbers. We see quite a lot of emergencies actually around pregnancy and sort of female reproductive issues for the ladies. Um, there are some complications and emergencies we also see that cuts across all age groups post in the operative and post-operative period after surgery is needed. In the
Okay.
children, I would say the biggest one, or one of the biggest ones, I should say, that we see is sickle cell disease. This part of the world has a heavy burden, and especially once you're getting to our lower socioeconomic status patients, we really do see quite a bit of difficulty with managing the children who have sickle cell. A lot of respiratory disorders in the children. So it's really quite varied.
Okay, it's quite varied. Hello, visitors. Hello, viewers. Today we have with us Dr. Abiola Fasina, who is an emergency medicine consultant, and she's also the director of EHCON. EHCON is the Emergency Healthcare Consultants of Nigeria, and she's also an independent instructor with us here in ThummimNg. Today we are discussing with her on handling medical emergencies. So far, so good. Dr. Fasina has told us that the commonest cause of medical emergencies in this part of the world is road traffic accidents. After road traffic accident, then we could now think about things like complications from easily treatable or even preventable diseases, especially infectious diseases. Now, we went further to ask out this question if there is some gender disparities or age disparities about the kind of emergencies that we see common. And she said, absolutely. For men, the number one remains the road traffic accidents and the traumatic emergencies. And sadly, for women, too, the traumatic emergencies are coming in via domestic violence. And then when you now consider for children, you think about sickle cell diseases. Thank you, Dr. Fashina, for this so far. If you have any question, please drop it in the comment section and on the live chat there, and we'll get to see it and address your question. Now, Dr. Fashina, is one thing to be a medic, a medical doctor, a nurse, or somebody within a healthcare, within the healthcare industry, encountering a medical emergency. Then it's another thing to be naive, like I don't know anything about this, and this is what I'm seeing. Like, oh, there's just an accident here, and blood is pumping. What next should I do? So, as a non-medic, what should someone do in an emergency situation?
Excellent. So I think I'll start by saying that the term medic is already problematic. Most places, at least where I've trained, medics actually denote paramedics. So I don't tend to think of physicians and nurses as medics. I tend to think of a paramedic as a medic or a pre-hospital care provider. So I suppose then you're asking me what you would do if you were not a clinician, if you were not a paramedic, if you were not a nurse, if you were not a doctor, and you ended up having an emergency. Well, the first thing I think is that people need to recognize that there's somebody in distress. How many times, and part of it is just our country and our situation, but how many times have you been driving somewhere and you just see a crowd of people around someone and people are yelling and screaming and just making a whole riot? And so they're quite common. So the first thing, of course, that you need to do, if you are bold enough to do so, is to recognize that an emergency is going on and then determine that you want to help. Once you get into stabilizing an emergency, you really can't back off. So the first thing probably that one needs to do, especially if they're outside, is then designate roles. You need to start telling people what to do before you get in there. So first of all, you can tell somebody, please go and help us find an ambulance. You call the emergency response line and see if you can get Las Ambos on the call. Please go out to the local clinic and see if the doctor can come and help us. Because once you sit down and start trying to do something about the emergency, you can't really leave. So the best thing is to actually just make sure you have done all of that as quickly as possible. Then the next thing is that once there's an emergency, probably before, you'll see people starting to move them. A lot of times we're very worried about trauma to the neck, trauma to the body. So first thing, please, is probably don't move the patient. You just see people carrying them anyhow, putting them in the car, let's go. As much as possible, you want to keep people non-mobile because you don't want to exacerbate any kind of neck or spine injury if there is a problem. Um, and then the next thing, of course, after that is then to do your own assessment. If they are vomiting, you might want to turn them on their side. Don't put any spoons in their mouth. Don't put any piece of wood in their mouth. Just turn them on the side and let them have the liquids come out onto the ground because they can swallow those liquids and end up with a very bad pneumonia. If there are any open wounds or cuts, you just want to try to keep the area as clean as possible without moving them, trying to straighten out the bones or anything if you are not skilled or trained to do those things. And then other than that, really just watching them, keeping the scene bare and clear so people are not jostling the trauma patient or the injured patient. And you just wait for help. That's really it. Unfortunately, it's the most difficult part of an emergency, the reining in your urge to go in and do something. Because that going in and doing something a lot of times actually is the source of problems.
Oh, impressive. So going in to do something is the source of problems for most cases, especially traumatic cases, right?
Yes, exactly. Because you can actually make the injury worse.
Okay. Okay. Now, sometimes there are certain things that make people anxious and they don't know what to do or what next. So let's assume, since we are using the commonest incident, which is a road traffic accident, and something just happened, who should they call? Where should they go? Is there something like emergency services directory or something like that that people can have an easy access to, depending on where they are? Probably the person is just use a road transport to come from Lagos to Enugu, and along the line somewhere in Edo, an emergency happened, and the
Yes.
person is totally strange about Edo State. So, where to go? Who to call? Since we are looking for help.
Yes, so this is one of the problems with our country and our state, that unfortunately we don't have very well developed emergency care systems. quite a number of people have come out now in the private sector. I really want to recognize 8 Medical, run by Dr. Tunde Oni. I think he's really doing a good job building up a service that really looks very nice. But there are a couple of other ones, but they are going to be at cost to patients. And a lot of times when these things happen, sometimes the people are alone, they're unconscious, we don't even know who they are. So who's going to start calling a private ambulance service to do that, especially if there's a cost implication? Lagos State has Lasambos, and Lasambos does try to is trying their best to really try to provide emergency care services. Remember that we're in a city of 21 million people with terrible traffic, and we still have a long way to go to really bring their skills up, even though they are really trying their best and doing very much to try to get their ambulances and their staff trained and certified. So the public option is Lasambos. Federal Road Safety Corps and the National Emergency Medicine Agency also have some jurisdiction over emergencies, particularly on the road. So those are some of the public options that may respond if you call the usual emergency line number in the state, which I believe is 112. But it's Nigeria, so 112, sometimes it goes through, sometimes it doesn't go through. And then when the public options come, sometimes, unfortunately, they are not well equipped. So what I would say is that it unfortunately usually falls to the people around to get this person to a hospital. Now, I just said don't move them. Yes, don't move them when the ambulance happens, when the accident happens, in terms of turning them over, putting a spoon in their mouth, trying to fix the fracture, just leave them. But once you've all determined what the plan is, if you figured out where you might take them, if there's a center somewhere where you think you can go to take them, they have to be moved very carefully. Usually we like to have somebody stabilize the neck, because any injury from the neck level down, that person is paralyzed all the way through. So you want to sort of use your hands. I'm going to use my phone to demonstrate, holding their neck like this. And then 2 on each side will gently lift the patient and usually move them into a car. If possible, the back seat, or if you have one of those trucks, you know, the jalopies that you used to see before, you can put them in the back, but it can be a very bumpy ride. And just get them to the health center. Now, even the health center is a tricky one, because not every center in Lagos can handle serious emergencies. And sometimes when you take people to some of these places, they'll turn them away and tell you that, you know, they can't do it or they don't have beds. A lot of it comes out of fear. So my advice would be that as much as possible, yes, you must take them to the closest health center. Find which health center first before you move them, though. Don't put them in the car and start driving. Let's decide where we are going. When you get there, that place may say they are not able to handle it, at which point I usually ask people to go to one of the teaching hospitals where you can take them into the emergency department. A place like Lasut or Lut would be your best option. Another option, especially in the road traffic accidents, is Igobi, which is the orthopedic hospital.
Okay.
That's in Lagos.
I understand.
Anywhere else, your local teaching hospital is your best bet.
I think EHCON should do us the nice work of trying to raise out a directory or something that we can use.
We've definitely thought about it and really tried to think about how we can do that. It's a bit more complicated than it sounds, and it really depends on the honesty of the medical institutions to really admit the capacity they have for managing emergencies. And that is not always accurate. So we certainly don't want to put out a product that would not be of benefit to people, but we've certainly thought about geo-mapping out emergency services in the city and sort of stating what each person has. Yeah. One good thing that's happening now, at least in the Lagos state where I live, is that our local health regulatory agency, FEMA, I started asking all of the health institutions to produce their accreditation and certifications. And it's a good initiative, because what that means is a lot of the mushroom operations will have to close. We have a lot of unlicensed health centers and facilities in the state and in the country.
Okay. Now, about that on who to call and where to go, it's obviously a long way to go, and
Long.
with so many compartments losing out their work within the system, until we get one or two right, we can put it in. So I have this next question on um, having some level of training with respect to emergency medicine or handling emergency, and I would want to divide the population into two. Let's say non-clinicians and then the clinicians. So
Patients.
let's start with the clinicians. Do you think that okay, let's start with the non-clinicians rather. Do you think they should have some level of basic training on handling medical emergencies?
Absolutely, I think so. And I'll caveat this by saying I'm biased because, of course, I run a training center for emergencies. So I want everybody to come and take this.
To come
We
in.
actually have a heart saver course through the American Heart Association, and it's for lay people. EHCON runs them. We run them every month, and it teaches you basic CPR. It teaches you how to use an automated external defibrillator in case somebody has a sudden cardiac arrest, teaches you basic first aid skills, and it's usually a 1 day course, and it's geared towards lay people. And it certifies you through the American Heart Association for 2 years as a first responder.
Okay,
And then, of
now
course, there are all kinds of other courses that we have that can sort of help you in terms of teaching you how to dress wounds, how to really respond to seizures. But the heart saver is the one I would think of for non-medics that is really the most sort of um, best overview. A few other agencies also run similar courses. SOS has one. International um, Red Cross has a similar course as well. So there are a couple of different places where you can actually get a sort of first responder training.
okay,
Econ
now
usually teaches the AHA version.
okay. So what he just gave us some of the trainings that we could get for non-clinicians. Now for clinicians, because I still have some questions I'll get back to at that point, but
Okay.
let's explore that of clinicians. At
So for
you know,
clinicians, I
yes,
mean, you'd be surprised that a lot of us, because emergency medicine is a new specialty in Nigeria, and also critical care, there's a very strong society. But people who are usually in these fields are people who are either trained abroad or have a very strong interest. And we're just really beginning to realize that it's something we need to buttress in our medical curriculum. Nevertheless, for clinicians, there's the basic life support course also through the American Heart Association you can take. It's kind of like the heart saver course, but for clinicians, so it goes a bit further. And then there's the advanced cardiac life support course that you can also take, that really goes through the advanced modules for stroke and for cardiac arrest that clinicians can do. These courses are really important. They'll sort of help you manage a lot of the most common outcomes of emergencies. For our medics, there's a few pre-hospital equivalents you can take as well. They are not a substitute for medical education and training, but at least they're a starting point for a clinician. And for those, we have so many people now who are going abroad. Usually, a lot of the agencies abroad want to see these sort of certifications for our clinicians and nurses when they're coming around. So, those are two that I can think of that you can take to sort of prepare yourself in terms of how to respond to an emergency that is undifferentiated, meaning you don't know what caused it for
okay. Now
clinicians.
oh, that's cool. Now when it comes to that how do we put it, this training that we are talking about, you as a person, Dr. Abiola Fasina, that we are talking about now, you have two courses already with ThummimNg. Can you tell your audience about these courses, what the content of the courses are like, and who are the ideal students for the courses, what they stand to gain when it's because we understand these things are already under emergency medicine, and that's why we're bringing more of it in.
Absolutely. Yes, we have a few. So Econ has a full curriculum. You can find it on our website. So for the courses I mentioned, the basic life support course gives you a certification for 2 years as a first responder. It's through the American Heart Association. It's usually about 8 hours. We usually start around 9 in the morning and end around 5. Takes you through what happens in a cardiac arrest, shows you appropriate CPR for adults, children, and infants, takes you through how to use an automated external defibrillator. You've seen it on the TV shows where they put the pads on and they say shock. So there is an automated sort of easy version of that. Takes you through how to deal with an allergic reaction, takes you through how to deal with a choking victim. Those are some of the things that are covered in the BLS course. And also make sure you can do CPR very well. Once you get to the advanced module, you're really beginning to, as I say, you're rock and rolling now. So you're going to start learning about how to manage different kind of cardiac abnormal rhythms. So the fast rhythms, the slow rhythms, how to manage a stroke, how to work in a team, how to run what we call a code, which is a cardiac arrest or life-threatening event where you have to assemble a team and move. We move from the automated external defibrillator to a manual defibrillator, which is the one with the paddles that you see on TV that can do more things than the basic course. We also start to add on medications like epinephrine or adrenaline to help people to jumpstart their hearts. And of course, it still covers CPR and all of those things. It also covers some airway management, how to treat a person who cannot breathe, how to help them when you have to bag them with the bag valve mask, some of the things you can do in those circumstances. So it takes it a bit further. I think another useful course we have, which we run through with Thummim, is our WHO Basic Emergency Care course. We usually run it over 4 to 5 days. It's actually one that we use a WHO menu and curriculum, and it was developed for resource poor settings where emergency systems are not well developed. It has a few modules. It goes through trauma, it goes through shock, it goes through dyspnea, respiratory diseases, talks about pregnancy and pediatric patients as well. And over 5 days, we take you through managing these managing the basic aspects of these emergencies, and also do a lot of skills training so people get some practical hands-on skills to use. So for the clinicians, those are some of the options they can take to start.
Okay. Now, you started from mentioning the basic course down to the advanced one. Now, that basic one, do you think is also a fit for non-clinicians?
So the equivalent course for non-clinicians is the heart saver I mentioned, where a lot of the basic skills are the same that are covered, but the depth to which they are covered is different. A basic life support course for a non-clinician would be difficult to follow because there's a lot of discussion of physiology and anatomy. But for the non-physician, when you take heart saver, it does cover the basic skills, and in addition gives you a lot of the first aid, first responder skills that in the basic course we don't cover because most of these people are nurses and doctors who do more than that anyway. But the heart saver would cover, how to splint a fracture, how to deal with an allergic reaction, how to do the Heimlich maneuver for somebody who's choking. And we cover those sorts of things in the basic course and the heart saver course. So if you're a non-clinician, that's actually the one I would refer you to because it would be easier to follow.
Now, that heart saver course brings me to the question I've been keeping in the cooler. You see, when we are talking about the common medical emergencies, we actually count in road traffic accidents. But somehow, one cannot complete any course on medical emergencies without having to deal with CPR, heart saving, those things. So can we get to talk about cardiovascular emergencies? I'm now using jargon, but whatever way, can we get to talk about heart emergencies so that the non-clinicians will understand what we're talking about, the common causes of these heart-related emergencies to prevent them, and what to do if they occur?
Absolutely. So I'm so happy you brought this up because a lot of the courses we have actually are geared towards heart emergencies. Learning how to deal with trauma is a different skill set, which a lot of these courses don't cover so well. But in the heart emergencies, I think the first thing you need to understand is that you need to know how to check a pulse because a lot of the algorithms start from, is there a pulse? Where are the places you can check a pulse? You can check a pulse at your wrist over this thing that we call the radial artery. And you should feel a thump, 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 thump over there. Another place you can check is in the person's neck, over here at the carotid. Those areas are usually open and easy to check. The third place that is easy to access is in the groin, in the femur. But unfortunately, I wouldn't advise anybody to start checking people's groins on the road, because some people might beat you thinking that you're trying to do something
Something
to this
good.
person. So just check it at the wrist, check it at the neck. If you feel, now pulses can feel different. They should feel strong, they should feel regular. You should be able to easily palpate it, as we say. Sometimes when you feel them, they feel faint, slow, thready, tells you the person is in trouble. Then you look at them. Usually, if you ask a person, you see a lot of times in emergencies, they're asking, what's your name? What happened? People are like, can't you see what happened? Just continue. But there's a method to the madness. When I'm asking you questions, when you are answering, it tells me that your airway is patent and fine. Because if you had an airway emergency, you wouldn't be able to talk to me. So usually when I'm addressing an emergency victim, even as I start my assessment, I'm asking questions. Hello, how are you? What's your name? How old are you? Where were you coming from? Because if they're talking and they're making sense, they're telling me a lot of things already. My
A
airway is
lot,
okay.
yeah.
My brain is okay.
Conscious, yeah.
Yes, I'm conscious, I'm alert, I can relate a story. So that's very important to do. Now, when you get there and they're not answering you and they're not talking, and we are black, so we don't turn, pale
Yeah,
we turn ashen. We kind of get this gray color as if you didn't put cream on your body that day.
it's true.
And then they start to just look very, awful. You can see when somebody is not looking right. That is an indication that you really must act. When we are on the road, there is no AED. And I'm going to actually ask one of my staff to bring the AED now so you can see. But there's no AED. But you feel the pulse, and if there's no pulse, that is when you start CPR. How do you do the CPR? You it's not up here and it's not over the belly. It's actually a bit lower than it's in the midline, just around here. So the nipples for the ladies are around here, and for men too, and they're just going between it, just around there. You want to interlock your fingers like this. Hey. Keep your elbows straight and you push down hard and fast. And that's how you do CPR. And you want to go hard and fast. We usually teach that you want to do about 100 to 120 per minute. So you'll see in the training courses, we are counting it out. 1, 2, 3, 4, 5, 6, 7. That's how you're going to do it. And you do your CPR if there is no pulse. If there is a pulse, please, in an adult, don't start CPR. So this is what you do. Children are a bit different because in children, sometimes you can start CPR on the basis of a very weak and thready pulse. Unlike adults where you don't do CPR unless that pulse is very, very weak. Unless that pulse is absent. So that is the first thing to do. In a cardiac emergency, is there a pulse? Because the pulse determines CPR or no CPR. One thing I would tell people now is the next time you are in a hospital or in a big bank or a big building, ask them, where are your AEDs? Where is this automated external defibrillator I've been talking about? The AED is actually the lay person's method of using for cardiac arrest. So this is our trainer module. Looks like this, and it has the 2 parts, right? And usually what happens is once you turn it on, the first thing to do in an AED is to turn it on because they know it's for lay people. So it will walk you through what to do. It will tell you, put on the pads. One pad goes here on the left side, and one pad goes on the left side around here. Why? This is the left side. Your heart is sitting like this. The idea is that the pads encircle the heart from outside. So when it delivers a shock, it's delivering it to the heart from both angles. So it'll tell you, put the pads on. Then it'll tell you, analyzing rhythm. When it says that analyzing rhythm, you need to put your hands. You can keep your CPR going during that time because the AED is supposed to help you to shock people out of the abnormal rhythms that cause cardiac arrest. So it will analyze the rhythm. And if there is a shockable rhythm, it will tell you charging. That's when you have to take your hands off, and it will say shock, boom. You have to say all clear because you don't want to shock yourself while shocking somebody. And quite important for people who have pacemakers, because the electricity can alter the pacer. So you want to make sure that when it's about to shock, the area is clear. And then it will shock if there is a shockable rhythm. If there is no shockable rhythm, it will continue to tell you continue CPR. So next time you're in your office, your bank, a big center where there's lots of people, go and ask them where the AED is, because that is the only additional thing as a layperson you can do in cardiac arrest outside of CPR to assist a patient who might have collapsed. So those are the sort of things that we teach in the Heart Saver course around cardiac arrest before your medics come, your paramedics, to come and help you with further management.
While we were discussing this in depth, I was just there in the background smiling and all those things. It was as if I've just triggered your talk spots. Dr. Fasina, start talking. And you were just like, even when you started demonstrating, this is really impressive. And I'm sure your visitors today are so happy to have joined in on this. And surely people who couldn't join in probably because of work will definitely have a replay to watch after this. You've heard it all, viewers. Dr. Fashina is here with all the hot and sauce to talk to you about medical emergencies. So we initially talked about the road traffic accidents, where I think Dr. Fashina has a team for demonstration because she even had to use her
I like
phone to
practical
demonstrate.
teaching. I don't like talking in theory.
So evidence she had to use her phone to demonstrate how to stabilize the neck and then how to carry. And we had a really little gap. Well, that's not her fault. It's the nation situation when it comes on who to call and where to go. Something we are hoping that very soon we could have the opportunity to address all these things. And then again, we now found ourselves discussing about heart and saving the heart. I mean, emergencies. In fact, I've not seen a discussion on emergency get complete without talking on hearts. So I had to make sure I bring it in. Dr. Fasina, it's been a wonderful time with you. Oh, by the way, because I understand that some persons may not join in, they may not be available when I read your bio. So I'm gonna put it up there again because it's such a wonderful person that we had on the show today. So they need to know more about you. All right, again, I know you're seeing her live, and this is still a picture of Dr. Abiola Fasina, who is an emergency critical physician and a health policy consultant. She's based in Lagos, Nigeria, and she completed her training in emergency medicine at Mount Sinai School of Medicine in New York. Now, Dr. Fasina has had several years of practice, and after that year, of those years, she then completed a 2-year fellowship in emergency point of care ultrasound. That's what we call POCUS, and a master's too in health policy research at the University of Pennsylvania. Now, Dr. Fashina is actively involved in emergency medicine care development and focus education in Nigeria. She's also an active board member and fellow of the Faculty of Emergency Medicine at the National Postgraduate Medical College of Nigeria. Her work has focused on capacity building of emergency health systems in low and middle income African countries, and she has worked in Nigeria, Liberia, Ghana, Rwanda, Kenya, Tanzania, Uganda, Zanzibar. So she obviously has extensive international experience. She is the medical director and CEO of Emergency Healthcare Consultants, a healthcare consulting company focused on capacity building and training in emergency medicine and critical care. She has managed, EHCON has managed several medical facilities, particularly in the era of COVID-19. And EHCON also runs the West African Sono Expert Academy with Sonosite Fujifilm. Dr. Fashina is also the Chief Medical Officer and Consultant Emergency Physician at Al Jolad Hospital, Lagos, Nigeria, and she's equally an independent instructor at ThummimNg. And that was the exact reason why I asked her to talk about her courses. We are so glad to have you here today. And your visitors obviously are so happy, just like Ifeloluwa just said. Thank you, Dr. Fasina, because of course nobody who has been here in this session will not feel as she's feeling. It's really an enlightening one, an interactive one, and we are happy on how you addressed our questions. If you have any further comments, you can actually put it down there in the live chat, and we can bring it up for Dr. Fasina to also see and appreciate. We thank you for your time, Dr. Fasina. We thank you for the explanations. You've all heard that we have courses there on the websites from Dr. Fasina and still in collaboration with other organizations that you can take, whether you're a clinician or not. You need to have some basic knowledge on handling medical emergencies. Today, we talked about road traffic accidents. We also talked about cardiovascular emergencies, that is, heart emergency. But you need to be equipped to handle more. You heard when she mentioned something on shock, when she mentioned something on allergies, and these are all emergencies that can spring up anytime, anywhere, unannounced, and just mess up your day. So you should be well equipped to be forewarned, is to be forearmed. So,
Wow.
Dr. Fashina, um, well, before we request for the last word from you, I love to ask some of my visitors these questions, several different questions. What is the best advice you've ever had?
Ooh, the best advice
Unexpected.
I've ever had.
Yes.
Wow. Well, it was actually my younger brother. He gave me this advice after I got back home from the States and I was starting my business. And I didn't ever think of myself as a natural entrepreneur. And people have given me variations of this advice ever since. But my younger brother told me, don't be scared, be a gangster. Basically, he was saying that there was no cause to fear any challenge. I just needed to go forth and just hustle and move and do what needed to be done. And I even have
Just
it on a post-it on my computer so that when I'm going crazy and I'm wondering how I'm going to get through this crazy country in this crazy economy, it's like, don't be scared, just be a gangster. That's what he told me.
like this is the very first time I'm hearing this. And well, I think I'm going to post it just the same way you posted it. Don't be scared, just be a gangster. You've got this, really. Thank you again. I usually pop in that question unexpected, yes, because I don't want people to come with scripted answers. I want it to be real, to be natural, and up here talking to your visitors. So, just one or two things left. Your last few words when it's related to emergency medicine in Nigeria, just for your visitors to hear, and we can call it a day.
All right. I think last words I'll say is obviously everybody knows that emergencies are unanticipated. That's why they're emergencies. And your best way of surviving them in this very difficult environment is through preparation. And so, beyond the fact that we run a training center, I truly believe that people do need to have the basics because we are in an environment where you really can't depend on the usual infrastructure to help you. So, if you're going to be the person in your community or in your family or in your church that really invests in learning these skills, so that when the time comes, because unfortunately the time comes, you're ready to do what needs to be done. That's the last word I'll give to the viewers and to those who are listening.
Right. Thank you, Dr. Fashina. You still have your visitors who are really happy with your discussion today. Ni
Thank you.
Ajay said, well done, Dr. Fashina. Yes,
Thank
we
you.
are echoing together to say thank you for your time. Thank you for joining in. Thank you for answering the questions. Thank you for demonstrating passionately too. And we are happy to have you here today. See you some other time.
All right.
And we hope to have you when we call. Guys, Dr. Fashina also have a course with us here on ThummimNg, so don't forget that you need to get some basic training for you to handle medical emergencies. Thank you, everyone, and do have a great day. Bye.
Thank you. Bye bye.
Bye.